You are watching Radicon. We have already discussed few epidemiological reports and we will do few more. There have been various reports on what impact radiation could have on newly born children and on the incidence of congenital anomalies before and after the Chernobyl accident. Comparison of the database of European Surveillance of Congenital Anomalies, or EuroCat, and of Finland, Norway, and Sweden showed no change in the incidence of malformations. In the Polisia County, in the northern half of the Ukraine, there are people who live in self-sufficient life in a contaminated area. As their name suggests, they live off collecting wild strawberries, mushrooms, and hunting fish in the forest. There is a report that neural tube defects have been increased among them, but the analysis is underway to determine whether it has been caused by radiation. The Radiation Effect Research Foundation has been conducting follow-up surveys to ascertain whether parents' radiation exposure increases their children's incident rates of lifestyle-related diseases, which are multifactorial disorders. The foundation has so far conducted a survey of childhood cancer, leukemia, a survey of solid tumors, and a survey of lifestyle-related diseases, but none of them revealed specific radiation effects. Radiation epidemiology dates back almost 100 years. Since the discovery of X-rays in 1895, there have been studies on skin and bone cancer in radiation workers, radium dial painters, and then effects of thoracotrust imaging. Then USA threw atomic bombs on Japan, and there were numerous studies on survivors. With the advent of medically indicated radiation therapy, more data became available for medium-range radiation doses. There have been continued studies on underground miners with view of radon gas effects among other radioactive elements. Nuclear workers, Chernobyl survivors, and cancer patients have been extensively recruited into epidemiological studies. Irradiated populations can be studied by following a cohort of exposed and non-exposed people and studying them prospectively, or it can be done retrospectively with the patients suffering from disease with regard to possible exposure as case controls. Cohort is a group of people sharing a common factor, for example, same age, especially in a statistical survey. Notable irradiated populations are people exposed from atomic bomb explosions, people exposed during nuclear and other radiation accidents, people exposed to medical reasons, people exposed to natural radiation, and the workers in the radiation industries. In the non-medical literature, one of the most iconic cases was Alexander Litvinenko, as seen in the middle picture, who was killed with radioactive particle used as poisoning mixed with the food. There are numerous challenges in epidemiological studies of radiation. The biggest of the challenges is scanty information, especially on consequences of low doses delivered at low dose rates, because number of people required are too big to prove any significant statistics. Also, there are fewer cases available for external high linear energy transfer radiations, and it is further complicated by presence and influence of confounding factors. In real life, more valid data comes from high dose or high dose rate exposure to low energy transfer radiation, including some radionuclide such as iodine 131I, and from high linear energy transfers internal exposure to an emitter in the lung, bone, or liver.
This video is presented in collaboration with Radicon Institute of Radiology. You are welcome to subscribe to our YouTube channel and click on the notification bell for updates. For more modules in Radiology CMEs, please visit our website www.radicon.org.